Well, thank you all for attending our Health Equity Summit, and thank you so much, Secretary, for joining us today. I just want to get right into the questions. The theme of today, obviously, is health equity, and we're coming to you on the heels of some really big news on that front. The Supreme Court just rejected a challenge to the Affordable Care Act, and we just got news that millions more Americans are signing up for ACA plans. Secretary, you have been involved in the ACA and its implementation since the very beginning. What do those developments mean for the state of health equity in America?
Van, first, thank you very much. And to the Atlantic, thank you for having me. And it means a great deal. Today, we're breathing a sigh of relief. We're moving forward. We're not talking about losing our protections against discrimination because we might have had a pre-existing condition like asthma that would have kept us from getting insurance. We're not talking about our adult children under the age of 26 having to search for health insurance all of a sudden because they no longer could stay on their parents' policies. We're talking about seniors who don't have to pay more today for prescription drug medicines because the Affordable Care Act disappears. And so, Van, it's a special day. And the greatest thing about special days is we get up in the morning, we see the sunshine, we don't think it's different. But for those of us who work really hard, toil to make sure we had the Affordable Care Act, we absolutely know the difference.
Now, you mentioned it's a special day, and it's one that you were obviously happy about. But are there more things to do on the coverage front, especially in terms of health equity?
Oh, without a doubt. COVID pressure tested our healthcare system, and we found that we had some real holes, in fact, some gaping holes in the system. And those holes, many of us probably could have identified before COVID and said to you, we have a public health system that leaves out too many people. There are corners of our country that have been missed for forever, and we are now seeing the results. So many people who died, principally in low income, in racial and ethnic minority communities, in rural parts of our country. We saw how the holes made it possible for COVID to be deadly. And so now is the time, especially with the survival now of the Affordable Care Act before the Supreme Court, to move to close those holes. So we make sure we have a system of health care that really does reach everyone and achieves that goal that President Biden identified of making sure that we treat health care like a right, not a privilege for just those who are healthy and wealthy.
Now, getting into COVID for a little bit, I believe the first 100 days of your time as secretary will happen this week. And obviously, co- fighting COVID was a big priority in those first 100 days implementation. Um, what we saw early on was the sort of stubborn persistence of health disparities in COVID and who was infected and who had access to the vaccine. And now, as we're moving to a state where more and more Americans are becoming vaccinated, how does the administration plan to keep COVID from becoming, again, an issue that is predominantly affecting lower income, Black, Latino communities in the United States?
And Van, here I think we have to recognize what President Biden has really produced. Because remember, before President Biden came in, we were suffering the infection and death from COVID at rates not seen anywhere in the world. In fact, even today, there's not a country that has more deaths as a result of COVID than the U.S. No country has more infections than the United States, anywhere parts of the world, even though we represent only about 6% of the world population. There are countries that are far bigger than us, like India, for example, which we've seen in the news because of how COVID has ravished that country. Just to give you a comparison, Van, because I think it's important so we don't forget, India, 4 times our size population-wise, still has fewer infections than the U.S. has had. It has fewer deaths than the U.S. has had. And so as bad as it is in India, the U.S. was far worse. But President Biden began to turn that around. And that's where what we see is the impact on communities that often are left out. Because as you know, it was our communities that are poor or minority that were often the ones that were left out. Today, we're reaching everywhere. And one of the biggest signs of that is how President Biden made it possible for the federally qualified community health centers, those community clinics that we rely on, the legitimate ones. All of them now offer COVID-19 shots. And as a result of that, we've seen millions of Americans get vaccinated. In fact, about two-thirds of every one of those individuals who got vaccinated is from a minority, ethnic or minority, racial minority group. And it shows you how the president is making an effort to go after those who have been left out in the past.
Now, looking forward past the first 100 days of the administration, past this first period, looking forward to a time when we might be returning our focus to some other health issues that aren't just COVID. What are the administration's priorities for ensuring health equity in that window?
Van, one of the first things that the president asked us to do at HHS is to target some of the real disparities that are out there. Quick example. You wouldn't think of it in a country like the U.S. with the most technically sophisticated healthcare system in the world. But we have death rates among women who give birth that are higher than in some parts of the non-industrialized world. Black women in America die at 3 times the rate as white women from pregnancy issues. And so one of the things that we're doing today is we're focusing on maternal mortality and maternal morbidity. We are going to try to make sure that we ensure that if you're going to have a baby, if you're going to deliver and become a mom, that we want you, not just for your child, but for you to be healthy. And so one of the things that we've done is that we have challenged states to take on a proposal which would allow a woman who has lower income under Medicaid to be able to maintain healthcare services post-delivery of a child, not just for 60 days, but for a full 1 year, 12 months of care. So far, Illinois stepped forward, and they're going to join with us. So today, a woman who is low income in Illinois will have an opportunity to receive maternal postpartum care for the full 12 months instead of just 2 months. Critical stuff, especially in some of our poor and minority communities. We're going to go out and we're going to continue to reach out to trusted voices in our disenfranchised communities to help us, whether it's with COVID or just making sure we get more people signed up for health care. Today, over 1 million people have signed up for health insurance coverage through the Affordable Care Act as a result of the president's special enrollment period under the ACA. And now, of course, that we know that the law will be around, we hope that even more people will sign up. And what they're going to find is they're going to get a policy that they can afford.
Now, I want to dig in for a moment on this issue of maternal mortality, which you mentioned. We have good research out there that says that, yes, a lot of it is a function of, a lot of it, especially among women of color, is a function of lack of access, lack of coverage, inability to interface with the healthcare system in a just way. But also, we have research indicating that at least some of the phenomenon of maternal mortality in the United States is due to the experience of racism, is due to the larger sort of constellation of injustice. I know your priorities as the Secretary of Health and Human Services focus tightly on health, but how do those priorities, how do your objectives on this issue meet with the larger sort of set of priorities and objectives on racial justice and how they might eliminate or reduce maternal mortality?
Yeah, it's as I mentioned before with regard to COVID, when COVID pressure tested our public health system, it wasn't as if those holes in our system were created overnight or that COVID created them. They've been around a long time. We've had unequal access to care for a long time. We've had discrimination in access to care for a long time. And what we hope to do now is address some of those inequities that have kept people from having the opportunity to stay healthy. Those social determinants of health, the things that drive health outcomes. So, for example, we know that in communities of color, diabetes hits us hard. Yet, too often, the studies that were done to figure out how to tackle diabetes excluded folks from the populations that were hit hardest. And so the studies would come out with results that might drive medicine and treatments, but that weren't really geared toward those who were hit the hardest. At the same time, we know that most folks who are uninsured come from some of these communities of color. Well, if you would have to wait longer, years before you get treatment for diabetes, by the time you go in to get treated, it's not just to try to keep your diabetes at bay. It's now to try to save you from having to have your limb removed because diabetes has essentially created a situation where you're going to lose limbs. Those are the kinds of things that happen when your healthcare system has a systemic inequality in it. And what we're going to try to do is go after that. And so with the American Families Plan that the president has introduced, we tackle not just health care, but we tackle wellness. And so that's why so much of the American Families Plan, which the president has proposed and hopefully Congress will pass, actually talks about investing in children, in child care, in pre-K. You would think that pre-K has a lot to do with health. It absolutely does, because if you get kids to be healthy and ready to learn, guess what? They won't become unemployed in the future. They'll be productive members who can afford health care, and they move forward without having to deal with the disparities.
Now, a good number of the things you've mentioned as objectives, as things to be accomplished under the Biden administration, they are effectively rollbacks, reversals, cleanup of what's been done to the healthcare apparatus in the last 4 years. My question to you is, how can you be sure that what you're doing will last past 2024? And what are you doing that can and will be permanent or have a lasting effect, regardless of what happens in future elections?
Van, that's probably one of the more important questions that I'll get asked. And the answer there is we need to make it clear to people how important it is that we reach you and that these services can be available to you. Because once you know you got them, you're not going to let them go. And probably the best example of that is Medicare, right? When Lyndon Baines Johnson, as president, helped get through the Medicare program with the resistance of most of Republicans and conservatives. He understood that by giving seniors in America a chance to stay healthy and not have to go bankrupt and poor before they could get health care, that he was creating an asset for Americans. And today, most Americans will tell you to make sure you keep your hands off of their Medicare and don't touch it and make it worse. And so the Affordable Care Act, today there are some 30 million Americans who count on the Affordable Care Act to get their insurance. Today there are more than 70 million Americans who rely on Medicaid to get their insurance. And I think everyone is beginning to recognize the value of some of these programs. And so what we're going to do is try to help make sure that people understand that these are indispensable to them because they make sure that they stay healthy. And so it's great to know that while there's been resistance by some states to expand access to Medicaid to their lower middle class and modest income families, that today some 38 out of 50 states have expanded Medicaid to include those populations. And by July 1st, we'll have Oklahoma joining. 39 states, only 11 states will be holding out. Some 4 million Americans would gain health care in those 11 or 12 states if those states simply adopted Medicaid expansion as part of their program for health care for their people.
Now, what's the key? What is the main leading argument for accomplishing those future expansions, for getting the rest of the states on board? It seems like a pandemic year in which millions of folks lost their jobs, and we had to expand dramatically our social safety net would have been the perfect sort of use or test case for expansion. So what's the argument going forward?
It's that none of us are immune from getting ill, from being the next victim of a COVID or another pandemic. And while we know that disproportionately people of color have died from COVID, of the 600,000 Americans who've died, they're not all people of color. And so you're in the sights of that virus. You're in the sights of that illness as well, regardless of your status and your zip code. You could be the next victim. And so working together, we want to make sure when that public health system is pressure tested again by another calamity or illness like COVID, that we're ready, because we're working together as a family to protect each other, because we know that if you're ill, I could become ill. And it is better for you to stay healthy because it helps me stay healthy. And that's the whole basis behind a system of coverage for all Americans, where regardless of where you live, you will have an opportunity to get the coverage you need because we all depend on each other to have a healthy California. And quite honestly, our economy depends on all of us being healthy as well.
So my question is, how do we measure success? Is it reducing the coverage gap? Is it the number of people of color or poor folks in certain communities who are allowed access to the vaccine and who get the shot? Is it more broadly speaking? Are we thinking about closing the life expectancy gap? What are the metrics on the table, and how do we know when we are approaching a more equitable state?
Yeah, success can be measured by numbers, the data. Some 175 million Americans have received at least one dose of the vaccine to date. That's an incredible number. It still has to go higher because there are more than 320 million Americans in this country. But 175 million is not bad, and we're going up there, going up there. But to me, it's not the numbers or the data, Van, that counts so much. It's the peace of mind. It's the parent knowing that, you know what, I can't take my child to the hospital, and I don't have to worry that I won't be able to pay the rent or the mortgage next month because I did so. It's the ability to know that you can move forward in your life. You can change jobs for that job you've always wanted because you're still going to have health care coverage wherever you go, whatever job you take. The peace of mind that comes from that is what helps the psyche of a country move forward for us to be even more successful. Because if you can dispose of the one of the biggest worries you can have, will my family be healthy? Will they be safe? Wow, you can launch. And so while we can measure success in numbers, I think you can measure better in smiles and hugs and in the number of people in America who are walking around with a light step because they know they don't have to worry about trying to decide if they should take their son or daughter to see a doctor or go to the hospital because they're not sure they can afford it.
Now, as we close out, I want to ask you one thing very briefly moving forward. We know that COVID, as you mentioned before, it is such a terrible tragedy in the United States, partly because of existing social political factors here. Looking forward to the next pandemic, to the next health crisis, to the next big problem, uh, what are ways that we can be sure that we are implementing lessons learned and that we can perhaps get ahead of the next one?
So, and you can keep asking this question because it'll always evolve. But one, good information. We today with social media, the internet, it is so easy to get information. But are you getting accurate information? We need to make sure people are getting accurate information because too many people are resisting even something like a vaccine on COVID because of disinformation. Two, accountability, making sure that we who are in charge of getting things done for the American people show that we did it the right way, that we can prove to you that we did our job. Three, making sure that as we do this, we're reaching everyone. We're leaving no one behind. We learned that telehealth allows us to reach people in rural communities, in inner city poor communities that don't have easy access to a doctor. You can now reach that patient without having to be in person. But we have to make sure everyone has access to broadband. And so we can learn a great deal, but what's most important is that we not make the same mistakes again. And if we are really reaching out to everyone, if we're really making sure that those who can reach are being held accountable, and if we make sure that the information people are getting is accurate, that takes us a long way. And then if we really do care, we will make sure that those who are most in need, we never fail them.
Well, that's about all we have time for. I want to thank you so much for your time, Secretary.
And thank you very much.